Well, let's get some expert analysis now on the country's vaccine rollout strategy. I'm joined now by Professor Shabir Madhi from the University of the Witwatersrand. Professor, thanks a lot for joining us this evening. We've heard there from the Minister just giving us an update in terms of that vaccine strategy. Does it inspire hope, in your opinion?
Well, it inspires hope insofar as the Department of Health seems to have undergone a 180-degree turn since Friday, when the chair of the Ministerial Advisory Committee was on SABC saying that the COVID-19 vaccine wasn't going to hold promise in terms of ending the pandemic. And today we heard the minister clearly state that the best chances of controlling the pandemic in South Africa is through vaccination. So on that aspect, it's really important that there's been a shift in terms of mindset at the Department of Health from just 2 or 3 days ago. And I think that has largely been precipitated because of the article that was released in the Daily Maverick from a number of scientists. What has been presented is not a strategy. It's an aspiration. It's an aspirational goal. And the reason I say that is simply stated that you can only have a strategy in place in terms of targeting 67% of the population once you've actually secured a supply of vaccine. And as the minister correctly pointed out, right now South Africa has not secured vaccine for more than 10% of its population. So we see trouble. The companies haven't been waiting for us to come to them to procure vaccine at our convenience and on our timelines. We need to understand that there's a huge global demand for vaccine. South Africa took a gamble and decided just to go with a COVAX facility until very recently. And the consequence of that, knowing that the COVAX facility itself had indicated that they would only be able to supply vaccine for up to 20% of the population, and we're going actually at 10% because of the cost of being involved in the COVAX facility, we did not enter into bilateral agreements with other companies. Now, one of the issues that was raised is that it would have been a financial risk to basically enter into bilaterals without knowing which vaccines were going to work and which were not going to work. And that, in fact, is not actually correct. And the reason it's not correct is that many of the countries, including Canada as an example, the reason why they've subscribed more vaccine that could vaccinate their population 5 times over is something called an advanced market commitment. Now, with an advanced market commitment, it doesn't mean that when you commit to purchase X amount of vaccine at a specific price, that when those vaccines don't work, that you're still forced to pay the price. You do not pay unless the vaccine actually works. And that's the entire principle of an advanced market commitment. And that is also the funding model of the COVAX facility itself. So when countries put money into the COVAX facility, it doesn't mean that you lose that money if there's no COVID-19 vaccine. You get your money back if there's no COVID-19 vaccine. But once there is a COVID-19 vaccine, you now got security in terms of being able to get supply of the vaccine timely. Now, where do we sit? In South Africa, I think we need to be clear that these decisions in terms of who to engage with regard to bilaterals should have taken place 6 months ago and not 6 weeks ago. It should have taken place 6 months ago, and it did not. And when you look at the vaccines that were spoken about, in fact, the options for South Africa were completely limited. To start off with, the Moderna vaccine was never going to be an option for South Africa. That is a vaccine that is funded by the United States government as part of Operation Warp Speed in terms of its development. Moderna has got limited capacity in terms of being able to produce vaccine, and consequently, the first few 100 million doses of vaccine that Moderna produces is already bespoken for by the United States government. The Pfizer vaccine was never going to be an option for South Africa because, as it was correctly pointed out, it needs to be stored at minus 70 degrees Celsius. You cannot deploy a vaccine that needs to be stored at minus 70 degrees Celsius in South Africa, where we struggle with cold chain facilities to be able to store vaccines even at 2 to 8 degrees Celsius. So that was never going to be an option. Now, there's 3 other vaccines. There's the AstraZeneca vaccine, there's the Johnson & Johnson vaccine, and there's a third vaccine that's also in phase 3 trials, which were basically much more practical in terms of being able to be deployed in South Africa, in addition to which the cost of these vaccines has been known for a long period of time. Already about 3 to 4 months ago, we knew that the Moderna and Pfizer vaccines were going to be costing in the region of $20 to $30 per dose, if not more, because those companies had made it clear that they are for-profit companies and they were going to make a profit on these vaccines. AstraZeneca, on the other hand, had made it clear that during the course of the pandemic, they were not going to make a profit on the vaccine, and their vaccine price was going to come in at $3 per dose. and Johnson & Johnson is coming in at a similar sort of price. Now, this information hasn't been available all over the past few weeks. This information has been available for 6 months.
Yeah.
So all of the decisions that have been made more recently in terms of engaging with bilaterals, which government had avoided until very recently, those decisions could have been made 6 months ago.
Professor, if I may just interject there, I mean, you're speaking about how there's been known information for over 6 months regarding even the effectiveness of vaccines, regarding the procurement of these vaccines. Then the question is, why is it that government has been dragging its feet to actually procure and secure a vaccine? Is it because we do not have the money for it? Is it because we didn't have the right strategy for it? Because if we've got known information, surely we should have implemented something more detailed and effective than what we've just seen.
Sure. Obviously, I can't speak on behalf of government in terms of the why. What I can say is essentially the effectiveness data only became available over the past 2 to 3 months. But the manner in which you go about in terms of your strategy to ensure that you got early supply of vaccine, such as Canada, such as South Korea, such as Israel, is by making these advanced market commitments. And for some reason or the other, government were not prepared to make those advanced market commitments or didn't have a strategy to actually employ that sort of an approach. And you do not lose out financially if that particular vaccine does not come to fruition in terms of safety as well as efficacy. There was no financial risk. It's not an issue of money. To vaccinate about 40 million people in South Africa with the AstraZeneca vaccine or the Johnson & Johnson vaccine as an example will cost roughly about 10.5 billion rand. 10.5 billion rand. Now remember, South Africa lost more than 300 billion rand because of the impact which the reaction to the COVID-19 lockdowns had on the fiscus. More than 300 billion rand. So when we talk of 10 billion rand, that is money that can basically be gathered through the public-private partnership very quickly in South Africa. It's not an issue of money. It's an issue of there not being a strategy in place and a delay in terms of engaging on bilaterals with pharmaceutical companies, and especially with those pharmaceutical companies whose products we know would be deployable in a country such as South Africa, and that had indicated that the prices will be for not-for-profit during the course of the pandemic.
Now, realistically speaking, we've heard from the Minister, Zweli Mkhize, just speaking about, the first quarter when we're looking at even having some kind of vaccine and even getting about 10% of the population vaccinated, etc., within the second quarters, and also looking forward to having a significant portion of the population actually receive the vaccine by the end of 2021. In your expert opinion, these timelines that have been given, a little bit vague, many may say, in terms of working within the quarters, are they realistic? Can we realistically say South Africans will have a vaccine by the first quarter, or even the population at large will be inoculated by the end of 2021? Is that a realistic picture that was painted today?
Yeah, like I said, it's an aspirational goal, and I don't think it's pragmatic. And it's simply not pragmatic because the big unknown is where we're going to get vaccine to vaccinate 67% of the population this late in the day, when most of the vaccine that is going to be developed, manufactured by the companies that have got data which supports the safety and efficacy of the vaccine has already been bespoken for. As an example, in India, the Serum Institute of India is producing the AstraZeneca vaccine, and they're going to start vaccinating almost next week. But the first 300 million doses of vaccine that the Serum Institute of India produces is not going to be exported. It's going to be used in India. South Africa's best opportunity to get any vaccine for the AstraZeneca vaccine is from the Serum Institute of India and not from AstraZeneca itself. And much of the vaccine that Serum Institute of India is going to produce has been bespoken for. So we might get some vaccine, but we're not going to get vaccine for 67% of the population, in addition to which we need to be realistic. When we talk our childhood immunization program, South Africa struggles to vaccinate even 75% of children under the age of 5 completely. It's a struggle that we've had for more than 20 years. To expect that overnight we're going to be able to put into place systems to reach 67% of the population by the end of this year, I think what Prof. Barry Shube said in a Daily Maverick article today, we shouldn't create false expectations, and that would be creating false expectations in my mind, because the planning that goes into being able to meet that sort of target is not something that materializes in a period of 3 to 6 months. The planning is enormous, and we simply do not have the infrastructure right now to be able to do that within the course of the next few months.